The Urgent Consult Clinic is something that started in October of 2012. And so since that time, what we've been doing is working with children and adolescents who are presenting with severe mental health concerns. So these are kids who are suicidal, who might have homicidal thoughts, who might be angry and aggressive towards parents or caregivers or even school officials. Kids who are really severely depressed or anxious that it's causing school refusal or really affecting their daily day-to-day lives. And usually these are the kids that end up going to the emergency rooms and staying there for hours on end waiting to see psychiatry. So what we're trying to do is have them come to our clinic instead to be able to be seen much quicker and in a much friendlier environment. So on any given day we could have up to 6 kids who are coming to see us either from the community or from the emergency room to be able to have a mental health assessment. And what we've heard is from the emergency rooms that it's actually decreasing the amount of wait times that kids are going there to have to wait 6 or 7 hours until they're seen, rather they can come and see us in the clinic with an appointment, usually within 24 hours. With having so much social media and kids being on the internet and really seeing things on the internet like some of the suicides that we've seen, some of the bullying that we've seen and the messages that have come out with that, a lot more kids are finding, at least when they're coming in to talk to us, that there's been an increase in the amount of cyberbullying that they've experienced, and that in turn is having an impact on their mental health. So a lot of these kids are I think, struggling day to day, and because of that renowned more information, and because it's more available and more discussed, that I think kids are starting to feel more comfortable to talk about it, and we're realizing that mental health has always had a stigma, right, of not wanting to be talked about, not wanting to be discussed, and I think our culture has changed from 30 years ago, and now we're a lot more open to talk about mental health. And I think youth especially have their own specific mental health concerns, and they feel a lot more comfortable talking about it now. I think there's a lot of great resources in the community, especially in Kingston and Lennox and Addington. Pathways, which is the mental health program for kids in the city, they have therapists in many of the schools. So a lot of times parents, that's their first reaction, is to go to the schools and access the services there. A lot of times they'll go into the community to find children's mental health, sometimes to the family doctor. And so the biggest thing we always talk to parents and kids about is to make sure that you're having that conversation, that you talk about what's going on, what are the troubles that your child is facing, what are the worries that they're facing, and if you feel that this is something that goes above and beyond kind of teenage angst and normal everyday experiences, then absolutely contact a professional, talk to your family doctor, have them refer to us or have them refer you to Pathways or to another mental health program. There's many in the region. Our catchment area goes all the way from Prescott in the east of the province all the way to Brighton in the west. So it's quite a large area that we try and cover, and we're trying to build a relationship with all those providers as well. Right now we're a 2-year pilot. And the first year that we've been in existence, our numbers have been above what the expectations were. So we're averaging about 40 assessments per month. And I think the original kind of goal was to be 21 to 29. So obviously the need is there. And what we're hearing from the community especially is that they don't want us to go away. They want this to be continually funded. And I think moving forward will be really helpful is that one of the conversations we have about adding a psychometrist to our staff, because that would really help with a lot of the youth who come in. They've never had any psychoeducational testing. And what's really important about that, especially when you're moving from secondary school to high school, a lot of times kids find the work gets progressively harder, yet they've never had testing. They've never had, do they need extra help? Do they need an individualized education plan? So a lot of times that's one of the services that we can offer when kids are admitted to our inpatient unit. But if we could do that in an outpatient for those urgent kids, that I think will even help to reduce even more of the stressors that they're finding in their life as well. I love working at Hotel Dieu. This is, I think, one of the best jobs I've had in my 20-plus year career. And I think for myself, having been a youth who lived on the streets, who was homeless, having immigrated to Canada from the US, and finding the very different styles that are here and the services that are here, that's what gets me up in the morning, wants to come to work, because I've been where these kids have been. I've struggled with suicide, I've struggled with my own issues, and so to be able to be here and help them and help them to know that, hey, I've been through it, I understand, and then to be able to see the results when they do get connected to services, I think it's a huge impact, and it makes me get up in the morning, want to come to work with a smile on my face.